So hello and thank you for participating in the Zoom telehealth call. My name is Gabriel and I'm a second semester nursing student at Compton College. Due to the COVID-19 pandemic, hospitals are not allowing nursing students to complete their OB and pediatric clinical hours. Instead, we will be performing an interview regarding your health history, which includes demographics, pregnancy history, medical history, and genetic history. Just to inform you, we will not be giving any medical advice. I'll just be gathering information. This interview is being recorded now and will be reported back to our instructor to fulfill our clinical hours. Do we have permission to do so and to conduct this interview?
Yes.
Okay, so can I just go ahead and start with your name?
My name is Priscilla Rendon.
And can I ask the age of your newborn?
She is 25 days old.
And your date of birth?
My birthday is September 8th, 1991.
And can I ask you how old you are?
I am 29 years old.
And is English your first language?
Yes.
Do you speak any other languages?
A little bit of Spanish.
And your religion?
Christian.
And your race or ethnicity?
Hispanic.
Do you have any allergies?
No.
Okay.
No allergies.
Are you married?
No.
And then, do you know the name of the baby's father?
Yes. Michael.
Okay, and can I ask for your level of education?
Bachelor's degree.
And the father's?
Associate's degree.
Okay, and your occupation?
Registered nurse.
And the father's?
Longshore mechanic.
And you guys are both full-time?
I'm currently on maternity leave, but yes, full-time when I am working, and he is also full-time, yes.
Okay, so now we're just gonna go ahead and move on into your menstrual history. Do you know when your period started?
My last menstrual period, or what age?
What age they started?
I think I was 14.
Okay, and do you know the average length they were?
At the time, they were like 5 days.
And do you have any abnormalities with your periods?
Yes, they sometimes only last 2 days. Sometimes they don't come at the same time every month.
Okay. And do you know when your last menstrual period was?
It was on April 23rd.
Okay. And do you know when your positive pregnancy test was?
The exact day, it was around June 20th.
Okay. And was that a urine test?
Yes.
Okay. And what day was your date of delivery?
What day was she born, or what was my estimated date of delivery?
The estimated day.
Oh, it was 2/10, February 10th.
Okay. So how many times have you been pregnant?
3 times.
3 times. Okay, and any spontaneous abortions, induced abortions?
No.
Any ectopic birth?
No.
So that means you would have 3 live children now?
Yes.
Okay. Going into the births, how old is your oldest?
5.
And is male or female?
Male.
And do you remember his weight at birth?
5 pounds, 13 ounces.
Okay. And do you remember how many hours you were in labor for?
I was induced. I was induced and it took 3 days. So I was in labor for 3 days.
Okay. And the type of delivery?
Vaginal.
And did you have any anesthesia?
I got the epidural.
Okay. Do you know at how many weeks gestation you were?
When I delivered,
Yes.
36.
Okay, and moving on to your second. How old is your second child?
My second is 2 years old.
And is that a male or female?
Male.
And do you remember his weight at birth?
7 pounds, 12 ounces.
And the weeks of gestation?
He was 38 weeks.
Okay. And do you remember how many hours you were in labor for?
I was also induced, but it only took, let's see, took about maybe 12 hours.
Okay. And the type of delivery?
Vaginal.
And any anesthesia with that delivery?
I had the epidural, yes.
And then for the last one, your baby you said was 25 days old?
Yes, she's 25 days old.
Okay. And do you remember her weight at birth?
She was 7 pounds, I think 7 pounds, 6 ounces.
Okay. And weeks gestation?
She was 40 weeks, just shy of 40 weeks.
Okay. And how many hours were you in labor with her?
She was quick. I was in labor only like 4 hours.
Okay. And the type of delivery?
Vaginal.
Any anesthesia with that delivery?
Yes, I also had the epidural with her.
Okay. With these 3 births, did you have any complications?
No complications.
Okay. So now we're just going to go ahead and move on to your medical history. And I'm just going to go ahead and ask you if you've ever come across any of these problems, starting with the OB. Any problems with anemia,
No.
fetal neonatal death or anomaly,
No.
gestational diabetes,
No.
hemorrhage,
No.
hyperemesis,
No.
incompetent cervix,
No.
intrauterine growth retardation,
No.
isoimmunization,
No.
polyhydramnios,
No.
postpartum depression,
No.
pregnancy-induced hypertension,
No.
preterm labor or birth,
No.
prom chorioamnionitis,
No.
ROGAM given,
No.
RH negative.
No.
Okay. So moving on into the gynecologic, any contraceptive use?
Currently,
Yeah, or pass.
I've had the IUD for a brief period of time. in between my 5-year-old and my 2-year-old.
Okay.
Otherwise, condoms.
Okay. Any abnormal pap smears?
No,
Okay. Fibroids?
no,
Any surgeries, gynecologic surgeries?
no,
Infertility?
no,
In utero exposure to DES?
no,
Uterine cervical anomaly?
no,
Okay, so now we're just gonna go ahead and move on to sexually transmitted diseases. Any problems with chlamydia,
no,
gonorrhea,
no,
herpes,
no,
syphilis,
no,
trichomonas,
no,
condylomata,
no,
candidiasis?
no,
Okay, and other infections, toxoplasmosis,
no,
group B streptococcus,
no,
rubella or the immunization,
no,
varicella or the immunization.
no.
Okay, so you're not immunized.
Did I get it while I was pregnant, or you're just asking if I've been
or
immunized?
yeah, are they up to date?
Yeah, all my vaccines are up to date.
Okay, that's rubella,
Yeah,
varicella.
yeah,
Okay, and how about AIDS or HIV?
no.
Hepatitis, the hepatitis B vaccination.
Yes, I've had my Hep B vaccine.
Okay, so now we're just gonna go ahead and move on to the cardiovascular. Any problems with myocardial infarction?
No,
How about within the family?
I think my grandma, I think she's had an MI. Like immediate or
Yes.
yeah, I think my grandma's had an MI
Okay. Grandma on your side?
on yeah, my side.
Okay. Any problems with heart disease?
High blood pressure, yes, but I think it's more I don't think it's genetic. I think it's because of the weight of my dad.
Okay.
Excuse me.
Rheumatic fever?
No,
Valve disease?
no.
Okay, and you said the chronic hypertension was just with your dad, right?
Yes, just my dad has high blood pressure.
Okay. Disease of the aorta?
No,
Varicosities, thrombophlebitis?
no,
Previous pulmonary embolism?
no,
Any blood disorders for you or the family?
no,
Anemia or hemoglobinopathy with you or the family?
no.
Okay. Blood transfusions?
No,
Okay, moving on to pulmonary. Any problems with asthma?
no,
Tuberculosis with you or the family?
no,
Chronic obstructive pulmonary disease with you or the family?
no.
Okay, any problems with diabetes within the family as well?
My dad is a pre-diabetic, and my grandma on my side is diabetic as well.
Would you happen to know what type she is?
Type 2.
Okay. Any problems with thyroid dysfunction?
No,
Maternal PKU?
no,
Endocrinopathy?
no.
Any gastrointestinal problems?
Uh, I think my mom has diverticulosis.
Okay. Okay, any problems with liver disease?
Mm, no.
Okay, cystitis?
I think my mom gets cysts.
Okay. How about pyelonephritis?
No.
Asymptomatic bacteriuria?
No.
Chronic renal disease?
No.
Autoimmune disease?
No.
Any problems with cancer with you or the family?
My uncle had stomach cancer. And I have another uncle. I'm not sure what kind of cancer, but he also has cancer.
Okay. And for neurologic disease, any cerebrovascular accidents?
I think my grandma may have had one.
Okay. Any seizure disorders?
Seizure. My cousin has seizures. Two of my cousins actually have seizures.
Okay. Any problems with you for migraine headaches?
Yes, I get migraines.
Do you take anything for those migraines?
Just Motrin or Tylenol.
And how severe would you say they are on the scale 1 to 10?
Probably about an 8.
Okay. Do you know if there's anybody in the family that has problems with migraine headaches?
My mom.
Okay. Any degenerative diseases?
No.
Okay. With the family too?
Not that I know of.
Okay. Okay, let's go to any psychiatric disease or mental illness?
Not that I know of.
Physical abuse or neglect?
No.
Emotional abuse or neglect?
No.
Any addictions to drugs, alcohol or nicotine?
No.
Any major accidents for yourself?
No.
Have you had any surgeries?
No surgeries.
Any anesthetic complications?
No.
Non-surgical hospitalization?
No.
Okay. So now just moving on to your genetic history. You could just let me know if there's any problems with yourself, the father of the baby, or anybody in the family that you know about. Any cerebral palsy?
Yes. You
Okay.
said anyone in the family, right?
Yes.
Yeah. Cerebral palsy, yes.
And that's with,
My side, my brother.
okay. How about cleft lip or palate?
No cleft lip. No.
Congenital anomalies?
On my fiance's side, he had a niece that had she had a heart defect.
Okay. Congenital heart disease?
No, just that
Just
heart
that.
defect. Yeah.
Okay. How about consanguinity?
No.
Cystic fibrosis?
No.
Down syndrome?
Yes, on my fiance's side, he has a niece that has Down syndrome.
Okay. Hemophilia?
No.
Huntington's chorea?
No.
Mental retardation?
No.
Muscular dystrophy?
No.
Neural tube defect?
No.
sickle cell disease or a trait,
No,
Tay-Sachs disease,
no,
test for Fragile X,
no.
or thalassemia, A or B? Okay. So that wraps up the health history summary. I just want to thank you again for participating. Do you have any questions for me?
Will all of my information be confidential?
Yes, this just goes back to my professor, and what this is just to help us fulfill our clinical hours.
Okay. No, that's all then. Thank you.
Okay, no problem.
All right. Bye.